Not sure if your baby's cough is just a cold? Here's how to know if it needs more medical attention. Hi, I'm Dr. Nancy Silva, mom and pediatrician in Wesley Chapel, Florida. Colds in babies are the most annoying thing for both moms and pediatricians alike because there's only so much we can do. They don't have a voluntary cough, they can't blow their nose, and they can't breathe out of their mouths. I remember when my kids would get their colds. I hated it. I hated it. You know, a fever, you can give medicine and it can come down, but a cold, there's only so much you can do. What can you do? You can put saline in their noses and you can suction it out. This was my best friend with my babies. So we got it at the hospital and I kept it, and you can get these over the counter, and now they have like nose Frida and really fancy schmancy stuff. But something this simple really helps. So you put the saline in on one side, you cover up the other, you push it all the way in, push it gently, and then as you're releasing the left hand, just like millisecond at a time, you slowly release this as well. And you're gonna hear all that sound. So it's a little bit shocking the first time. How often do you do it? You don't wanna do it too often, because then their little noses are really sensitive and they can start getting nosebleeds. So you just wanna do it before they're going to feed, so they have a best chance of really breathing well, because we all know what it feels like with a stuffy nose and you can't breathe. The difference is we can breathe through our mouths in between, they can't. Saline helps, nasal suctioning helps, also a cool mist humidifier. So what's normal in a cold in a baby? Typically, a baby can have a cold easily for 2 weeks. That's right, 2 weeks. Everybody thinks it's gonna get done in just a few days. The first 2 or 3 days are usually the worst. The most nasal congestion, the coughing, the not very comfortable, the not really drinking well, the not sleeping well at all. So if you thought you weren't really sleeping before, you're really not gonna be sleeping now. After about 2 or 3 days, they kind of stabilize. So they stay the same and they don't get worse. And that's when we say when to worry. If your baby is still worsening after the 3rd day, you wanna bring them in. You got a little newborn, a little baby, a couple of months old, they just, up until about 6 months old, they just don't have the same immune system. It even goes on beyond that, really, through 2 years old, because you get this really strong immune system as you age in just the first 2 years. But there's a few things we worry about. One, constant cough, that cough that doesn't stop. Occasionally, there will be a child who has whooping cough, also known as pertussis, and that's very deadly. It's not that common. We don't keep it on our radar right off the top, but it's important to tell the pediatrician there's this cough that just doesn't stop all day or night. More commonly though, that cough that's throughout the day and night, not constant nonstop, but still constant, is we start thinking about things like pneumonia or ear infections. Little babies don't typically get throat infections, but they can get ear infections, and they can very easily in those first few months develop a pneumonia. Another situation, if your baby has a barky cough, it tends to be croup. We call it a seal bark. Lots of parents just call it a barky cough. And it has this very odd sound, and that needs some supportive measures. Sometimes it's steroids, sometimes it's a nebulizer to just dilate and have all the airways open up so they can breathe better. Every once in a while, if there's bad enough croup, you do have to be hospitalized, but most of the time, if you get in soon enough, then we can give supportive care and help. The other big one that we really worry about, and we'll tell you, watch your baby's breathing. So are they stuffy and, uncomfortable, not breathing great? That's to be expected. But are they really working to breathe? Typically you'll see the rib cage going in and out and in and out. That's, again, no brainer. We want you to call, we want you to come in, and we want your baby to be seen, because your baby probably does need quite a bit of supportive care so that your baby can stay safe and stay alive. I hope this video helped you know when to worry and when not to worry when your little baby has a cold, if it's a cold or if it's more than. Constantly creating some new free guides, and I do have a fever guide for babies through 2 years old. So if you'd like to check it out, you can follow the link below, or you can go to my website, drsilvakids.com. Until the next time, be kind to yourself. Bye-bye.